In Durham, Latinos make up about 15% of the population. And at the state level overall, we're over 1 million strong now.
When COVID-19 was at its peak, Latinos made up more than 75% of positive cases in Durham. Something needed to be done. So a group of Duke doctors rallied together to create Latin-19, a crisis response organization to educate and improve the health of the Latino population.
We started with a meeting of several leaders, Duke faculty, members of the community, members of the public schools, public health, and other community-based organizations to say, hey, there's a community that needs information and there's no information in Spanish.
And understanding how health disparities affect our Latino community, we wanted to be ready to support them in any way we could. Imagine if you don't speak the language and you can't get accurate information.
The group launched an ambitious educational outreach program with Spanish-speaking television spots, web and social media announcements, and pamphlets at community organizations and schools. They forged partnerships with state and county health departments to get the word out statewide about COVID-19 and where to get vaccinated. And they enlisted high school students to share information at their schools.
Many members of the communities are on this pending status waiting for immigration interviews, and they were really afraid of using the health system as a reason against them.
The group worked with the state legislature to change the policy that required identification to get a test for a vaccine.
Then you started seeing the Latino community come out.
By the end of 2021, the Latino community had come out in force at testing and vaccination events, and the Hispanic vaccination rate was on par with non-Hispanics.
When Latin-19 was involved in those events, the rates were very, very high. So it clearly shows the trust that our community has in Latin-19 and how partnering together can really make these events successful.
The height of the COVID pandemic might be over, but the Latin-19 group's impact is still going strong. The core group is made up of 9 members, and there are hundreds of healthcare and community members playing active roles.
I'm very proud of everybody and all the efforts that we're doing together.
The group advocates nationally for the Latino population, in Congress and in national news outlets about health disparities and challenges for the community.
The COVID pandemic is over, but the health inequities affecting the Comunidad Latina are not over.
They are our children, they're our classmates, they are the folks who help us at a store, they're our doctors, our nurses, our teachers, our mayors. And so we're all in this together, and we cannot forget these disparities as COVID is going away.
The group advocates Latino participation in clinical and community research projects and takes an active approach in setting a research agenda that is responsive to the priorities, needs, and resources of the Latino community.
It will be the proudest the day we feel that La Comunidad Latina has achieved a space of equity, that it has achieved a space of being listened to and respected in all of its contributions to the United States society.